Hello students, today we shall study about valvular heart disease. So this we are going to be discussing about the diseases associated with the valves of the heart, and the valves actually control the blood flow from one chamber to the other. Now the disorders or the diseases associated with the mitral valve include mitral valve prolapse, mitral valve stenosis and mitral valve regurgitation. The meanings of these terms will be explained as we go. To begin with, we shall understand the structure of the heart. As we know, the heart has the four important chambers: right atrium, right ventricle, left atrium and the left ventricle. Okay, so the blood flow from the right atrium into the right ventricle is being controlled by the tricuspid valve, and from the right ventricle into the pulmonary artery for purification is being controlled by the pulmonary valve. The blood flow from the left atrium into the left ventricle is being controlled by the mitral valve, and from the left ventricle, where the blood just gets circulated to the entire body, is being controlled by the aortic valve. Now, any disorders or diseases or conditions associated with these valves turn out to be big problems. Okay, so what kind of diseases are usually associated with the valves means it is normally the valves get narrowed or thickened due to certain risk factors or etiological factors, and sometimes also it can happen that the valves become floppy, means they are very sluggish or they are very saggy. Okay, so they are not firm enough to control the blood flow or to allow the blood to flow in one direction only. So when the valves become weak and saggy, and sometimes they even prolapse in the sense that they just protrude, and which again is due to some kind of etiological factors which you're going to be studying further. And all this kind of disorders associated with the valve causes major problems with the circulation to the rest of the body. Now the heart valves, this picture actually shows you in depth or clearly the heart valves. Okay, so the tricuspid valve on the right and the pulmonary valve, and onto the left we have the mitral valve and the aortic valve. So you really need to understand the structure of the heart and also from where these valves originate, so that you will be able to give a clear picture about what kind of blood is being sent for purification and what sort of blood is being sent for circulation to the rest of the body. So you really need to understand the clear or correct positioning of these valves. Now the definition of valvular heart disease, we can define it as a characterized by damage to or a defect in one of the four heart valves. Okay, as I mentioned earlier, it could be just due to some disease or due to some damage or a defect in these valves, and the valves, as we mentioned, includes the mitral valve, aortic valve, tricuspid valve or pulmonary valve. Any of the four valves can get affected by such condition. An acquired or congenital disorder of a cardiac valve characterized by stenosis means obstruction, or regurgitation means backward flow of blood. It can also be a congenital disorder. So this is what it is explaining to you what is valvular. Now the types of valvular heart disease, you can classify it as two types. Okay, what are the common diseases associated with the valves? It includes stenosis and regurgitation. So stenosis basically means constriction or a narrowing of the valve, and in this picture you can appreciate that very well, how a normal valve looks like and how a stenosed valve looks like. Even supposed to be open, the valve still is very constrained, so that means it does not open fully for the blood to flow effectively. And what happens in regurgitation means the incomplete closure of the valve leaflets, where the valves are supposed to be closing, it still does not close appropriately, and it still remains an adequate amount of space is still left. So what happens, there is still backward flow of blood, and that is called as regurgitation. Now a stenotic valve, what it does is it forces the blood to back up in the adjacent heart chamber. So that means when a valve is stenosed or narrowed, or it rather means it is like there is some kind of obstruction or constriction, then what happens, whatever blood has to flow, for example we are talking about the mitral valve here. So whatever blood has to flow from the left atrium into the left ventricle, when there is a stenosis or other constriction or obstruction, then most of the blood still tends to remain in the left atrium. So what happens there? The blood starts to get collected, it gets overloaded, and also the pressure builds up. Okay, so that is what happens in stenosis. And in regurgitation, what is going to happen? Whatever amount of blood has flown from the left atrium into the left ventricle, and when the blood is supposed to be flowing from the left ventricle into the aortic valve and into the aorta, through the aortic valve, and into the aorta to be circulated to the rest of the body, but it does not necessarily happen that way. What happens in regurgitation is most of the blood is going to be back flowing, means back and forth the blood starts to be flowing, and eventually what happens, the adequate amount of blood which is supposed to be circulated to the rest of the body will not be circulated, because most of them still tends to remain in the left chamber of the heart. Now the heart valve problems, this is in detail, which is just giving you an in detail, or you can make your notes from this. Okay, so regurgitation, stenosis, and atresia. So atresia is also a condition. What happens is here the valve isn't formed fully. Okay, so it just looks like a sheet, or it's just like a block of tissue which is just there, and what happens is this blocks the blood flow between the heart chamber. So literally you see that there is no great opening there. It is just it just feels like a flap of tissue sitting there, and the blood is not able to flow appropriately. Okay, so this is just giving you an explanation of what is regurgitation, stenosis, and atresia. So just remember, atresia means it is a congenital or it's a condition where the valve just looks like to you as a solid sheet which is sitting there, which does not really open and allows the blood pass. Now, what are the signs and symptoms of heart valve disease? So most commonly the signs and symptoms you will see, there is a fluttering chest sensation, means again there will be palpitations. The patient is going to be experiencing chest pain, or otherwise called as angina. Definitely shortness of breath is most of the time when we have seen patients coming in or walking in with a and when they complain of the shortness of breath, and you do certain investigations and check, and then you realize that this is a typical condition of a valve disease. Okay, so excessive fatigue and weakness is also experienced, tiredness and rapid weight gain, lightheadedness or loss of consciousness, coughing, swollen ankles. Again, the swollen ankles is because of the backlogging of blood, and there is the increase in pressure. It's again because of the stenotic valve. So most of the and that is what I explained to you. When there is a stenosis or constriction, the blood doesn't actually flow appropriately, and most of the blood gets backlogged and just collected, and this keeps on building, and that causes an increase in volume. That's going to be volume overload, and eventually there's also going to be hypertension, and this eventually causes the swollen ankles. Also, because of this edematous condition, and because of the backlogging of blood on the one side, on one portion of the heart, again what is going to happen, this is also going to be causing ascites or abdominal bloating, and also there's going to be hepatomegaly and conditions like that. Okay, so all this is because of the backlogging of. Now, what are the risk factors and complications associated with this valve disease? It includes, the risk factors are hypertension, so high BP or high blood pressure is a very common risk factor. Rheumatic fever, okay, so that is again a kind of infection, that is, it begins off as a sore throat. It's also called as a strep throat, and this kind of repeated infections eventually starts affecting the heart valve, so that is the reason why we call it as rheumatic fever. Infective endocarditis, again it is inflammation of one of the layers of the heart. Congenital malformations, and also Marfan's syndrome. The complications will include heart failure, stroke, blood clots, heart rhythm abnormalities, and even. What are the tests and diagnoses? Now, once a person comes into you and with all these signs and symptoms of feeling excessively tired, fatigue, and shortness of breath, not able to walk for long, and excessive tiredness and weakness, and severe difficulty in breathing. So you're going to be running a few tests, diagnostic tests and investigations, and in order to come to a conclusion about what exactly the patient is experiencing. So some of the most common tests include a chest X-ray, doing a 12-lead electrocardiogram, an echocardiogram, doing a stress test. Okay, so exercise tolerance testing is very important. That actually shows us the amount of stress the heart can actually take, and in spite of that, if it is able to function effectively, then you're fine. But again, it all depends upon how much of stress the heart is able to handle, and if it is not able to pump in adequate amount of blood, and all that is being seen when you are being monitored during the exercise stress test. and eventually the best way to find out this is by doing an angiogram or angiography, wherein you will be checking on the valve, the chambers of the heart, the amount of blood flow, and all this is going to be diagnosed by doing all this tests and diagnostic tests. Now, mitral valve prolapse. Okay, so this is a condition where the two valve flaps of the mitral valve do not close smoothly or evenly. But what they tend to do is they tend to bulge. Okay, so in this picture, one picture here is showing you the normal mitral valve, and the other picture is actually showing you the prolapsed mitral valve. So that means you can see the literal bulging of the valve and into an upward position into the left atrium. Okay, so mitral valve prolapse is also known as click murmur syndrome or Barlow syndrome or floppy valve syndrome. So that is what I was telling you to begin with. These valves tend to be floppy and saggy, and they tend to bulge, and eventually what is going to happen, they are not going to be function effectively. They are not in a position to control the adequate or appropriate amount of blood flow from one chamber to the other. So this is the condition of mitral valve. What are the causes for this? It can be caused due to abnormal cartilage, abnormal cartilage, which is nothing but the connective tissue diseases are also one of the most important causes for this particular. Now, the main clinical manifestations will include fluttering or rapid heartbeat, shortness of breath, dizziness, fainting, patient is being very panicky, anxiety, numbness, and tingling in the hands and fingers. The diagnosis of mitral valve prolapse, again, as we mentioned to you earlier, best sorted with doing an electrocardiogram, a chest X-ray, transesophageal echocardiogram, and an echocardiography. So this is how you will check the effectivity or the function, where there's going to be hypertension and an increase in the blood pressure conditions. And for that, again, the patient will be put on beta blockers, and also to prevent blood clots, the patient is going to be on blood thinning medications. And as I mentioned, because of this backlogging of blood and there's increase in blood pressure, and this is also going to be causing an edematous condition, means there is going to be fluid overload or volume overload, and for this condition we need to make sure that the excess fluid is actually removed. So the patient will be put on diuretics, which actually removes the excess fluid from the body. Vasodilators in order to improve the blood flow, and antibiotics in order to prevent any sort of infection, because we learned that some of the etiological factors also include rheumatic endocarditis and also rheumatic valve or heart disease. So these are all associated with infections in the past, and in order to take care of such infections, antibiotics may also be prescribed. The next condition, that is mitral valve stenosis, is nothing but a narrowing of the mitral valve opening, that is it obstructs the blood flow from the left atrium to the left ventricle. The mitral stenosis usually results from rheumatic fever, but infants can be born with this condition. So means it can be a congenital disorder as well. Mitral stenosis does not cause symptoms unless it is very, very severe. So all the clinical manifestations which we discussed is mostly the patients start to exhibit these conditions only when the valve's disease is extreme or severe. Until then, most of the times the symptoms are not shown up. So in this picture again, you will see one picture showing you the normal heart and how the valve is supposed to be functioning, whereas in a stenotic valve, that is nothing but a mitral valve stenosis condition, you can see the amount of blood that actually flows into the left ventricle. Okay, so this is the actual amount of blood that is supposed to be flowing, but when the valve is stenosed or constricted or narrowed, you can see the amount of blood flowing into the left ventricle. So you can imagine how much of blood actually gets pumped to the rest of the body. So this is a reason for all the clinical signs and symptoms that are exhibited by the patient. Okay, so this is what happens in a mitral valve condition. Stenotic. Etiology for this includes rheumatic heart disease or rheumatic fever in the past. It also may be due to calcification, means there is calcium deposits, or where the valves become really hard and also rock-like, and eventually it is not able to function effectively. It can also be congenital, means the person can be born with this kind of disease. It can also be due to some kind of fibrosis, okay, valvular disease, that is due to fibrotic conditions, and that can cause the hardening of the valve. Now, what happens during this condition? So that means we are talking about the pathophysiology. So what really goes on due to the narrowing of the mitral valve? Again, what is going to happen? All the blood that is going to be sitting in the left atrium is going to get clogged up and logged back. Okay, so there's going to be excess logging of blood, again because the purified blood actually comes into the left atrium through the pulmonary veins, and what happens there is excess of fluid or volume is going to be increasing. That causes an increased left atrial pressure. This again causes increased pulmonary pressure, and there's going to be excess pulmonary congestion. Okay, because of this, there's an appropriate exchange of gases is not going to take place, means there's going to be diminished exchange of gases, and that is what causes the fatigue and dyspnea or orthopnea in the patient. This eventually can lead to right-sided failure, because again all this pressure is going to put a lot of pressure on the pulmonary structures, and finally that is going to put a lot of pressure on the right side of the heart. Now, due to this left atrial pressure, what is going to happen, as I told you, there's going to be excess volume of blood there. So that is going to be causing a hypertrophy of the left atrium. Means again the left atrium starts bulging, and because of the excess volume of fluid there, or rather it's nothing but the blood in the chamber. Now, there is going to be decreased blood flow. Now, what happens the other way? So now this is what is going to be happening from the right atrium point of view. Now, what happens to the left ventricle, what is going to be happening from the left atrium point of view? That is what we saw in the first part of the pathophysiology. And now what is going to be happening from the left ventricle point of view? There's going to be diminished blood reaching the left ventricle. As you saw, the amount of blood that is reaching the left ventricle is very, very minimal. Due to this, what is going to happen? There is going to be decreased cardiac output, and there is also going to be left ventricle atrophy, and this is going to cause excessive fatigue, and because the person is not in a position to receive appropriate circulation, and also the body is not able to receive the circulation to the rest of the body. Eventually the body is going to be feeling excessively tired and weak. Some of the clinical features will include, again, there's going to be palpitations, also on auscultation, that is when you are checking the patient, that is doing a physical examination and listening to the heart, you're going to be listening to the extra heartbeat, and there's going to be the murmur, which is nothing but the turbulent blood flow. Turbulence, again, it's going to be harsh. That is always associated with the flowing of blood through the valves, and so you will listen to a peculiar sound when you listen to the chest of the patients, and also the patient is going to be exhibiting pulmonary edema, and this is also going to be like the increased pulmonary capillary pressure. The symptoms will include breathlessness, fatigue, edema, palpitation, hemoptysis, which is nothing but it can also be like coughing up of blood, and cough, pulmonary congestion is going to be seen, chest pain, that is it also due to nothing but the pulmonary hypertension, and also there's going to be thromboembolic complications, which is nothing but the clots that are going to be formed, and that can eventually lead to complications like stroke, and also it can also eventually cause death as well if not attended to properly. The medical management for this kind of condition will include, again, due to the blood clots, again the patient is going to be on blood thinners, anticoagulants, and also in order to take care of your blood pressure. Okay, so the patient is definitely going to be on digoxin, beta blockers, calcium antagonists, definitely on diuretic therapy because of the the edematous condition has to be taken care of, and definitely going to be on antibiotic prophylaxis or treatment in order to treat the infections, if any. Now, if the disease is mild, the patient is going to be on medical management, but if the disease is very severe and the patient is finding it really difficult to breathe and carry on his day-to-day activities, then the only option is having a surgical management done, and that will include a balloon valvuloplasty, mitral valvotomy, and mitral valve replacement. So what is going to happen is, again, either the valves are going to be removed and are going to be replaced with a prosthesis, which is nothing but an artificial valve that is going to be sitting in the position of the so-called valve, and that is going to be taking over the function of the blood to flow from one chamber to the other. Now, this is how it looks like. So, a mitral valve replacement. So, this is what nothing but the mechanical valve or the artificial valve. So, this is how it looks like. It gets sutured onto the position, the exact position where the valve is meant to be, and you can see the flaps. Okay, so this is how the blood actually flows through these valves, and the blood flow can be controlled and the patient's symptoms can be minimized. The patient is definitely going to be feeling better because the body is actually receiving adequate amount of blood supply due to the adequate functioning of the valves. Now, percutaneous mitral valvuloplasty. So, valvuloplasty, again, this is a procedure which is going to be done in the cath lab, and this includes, just like how we saw during the coronary artery disease, like a catheter with the balloon is being put in position, and maybe a stent at times, depending upon how narrow the artery is, And in the same way, here also we have a valvuloplasty where you can see the catheter and a big fat balloon. Okay, so when you put in that and you dilate the balloon, the valve is going to open up, and depending on how much the valve actually is diseased or stenosed, and even after putting the balloon and opening, we again check with putting in the contrast how much of blood is flowing, and still not adequate, then what happens, we also put a stent in place which can actually leave the valve open, or rather control it, and that can also effectively take on the functioning of the valves. Yeah, so this is how it looks like. So balloon valvuloplasty, you can see this here, and that is how you will deploy the valve in position. So this is how you can see the catheter going in with the balloon, and then it also has the valve sitting there, and you can see like the stent like structure on that. So that is how it is actually being deployed, and this is being carried out, and the circulation can be, the patient symptoms can be minimized. Mitral regurgitation again is defined as an abnormal reversal of blood flow from the left ventricle. So what is happening is, as I told you, here the valves are not in a position to effectively close. Okay, even after it is supposed to be closing, it is still there's still an adequate a portion that is open, or rather you can see in what is that space. Once even still the valve is supposed to be closed, you can still feel that the valves are kind of open, the flaps are not closed completely. Because of that, what is going to happen, the blood from the left ventricle again is tending to flow back into the left atrium. Again, doing this, again the left atrium volume is also going to get higher, and again there's going to be pressure build. So let us see what is the definition of mitral regurgitation. It is defined as an abnormal reversal of blood flow from the left ventricle to the left atrium. It is caused by disruption in any part of the mitral valve apparatus. Okay, so you can, this picture clearly shows you or defines what exactly is mitral regurgitation. What are the causes for this? Again, it could be due to mitral valve prolapse, any kind of damage to the valves. It can also be due to any kind of conditions associated with the heart, rheumatic heart disease, rheumatic valve disease, ischemia, infection, or any kind of congenital disorders. The symptoms again here will be almost similar: dyspnea, edema, ascites, fatigue, palpitations, and also thromboembolic complications. So these are all the kind of signs and symptoms that you normally experience or see in patients with valve disease. And on examination of the patient, especially when you're checking on the patient, physical examination, and also listening to the chest, you will begin to hear the extra sound, the third heart sound, and especially that is like a turbulence in the flow of blood, and that is associated, or it is related to the backward flow of blood, and that is particular term for that is going to be a murmur. Okay, so that is what you will normally see in patients with a valve disease. Now, how do we diagnose this particular condition? Again, a thorough physical history collection, physical examination, ECG, electrocardiogram. It should also include an echocardiogram, transesophageal echocardiogram, chest X-ray, cardiac MRI, cardiac CT, exercise stress test, and eventually cardiac catheterization. So the cardiac catheterization will give an adequate answer or appropriate answer to this particular condition, because you will be able to see it better once you do an angiogram and checking on the valve chart. Now, how do we manage this particular condition? Again, as we know, there is going to be backlogging of fluid, that is going to cause excess fluid volume or overload, and that's going to eventually cause blood clots in the thing, and for that we need blood thinners, or it also includes anticoagulant therapy, diuretics, high blood pressure complications or medications for the blood pressure, antibiotics, and also, now how do we control this or prevent this particular condition? Again, there should be a lot of modifications in your lifestyle as well as in your diet. Now, another surgical management for this, now this is like a valve repair. Okay, the management for this kind of condition includes a valve repair, and for this it is it's something called as a mitral clip. Okay, when you see this picture here, this is actually going to put kind of a, it's going to hold the valve together. Okay, like it's going to have a mesh like feature here, and that is going to hold the valves or the flaps together so that the valve does not kind of remain open, and that is going to keep the blood flow under check. And this particular procedure is called as percutaneous transcatheter valve repair, and that is nothing but done by placing the mitral clip in the valves of the heart. Surgical valve repair can also be done because the excessive floppiness of the valves, and the valve can be really saggy, so that portion of the valve can be actually removed and it can be sutured back in position so that the excess valve portion can be removed, and that will actually control the blood flow. Similarly, the mechanical valves or the artificial valves or the prosthesis, and this is how it looks like. So this is also can be checked, and it can be placed in the valves in the positions of the valves, and you can actually control the condition or make the patient feel better by surgically putting these valves in position. Very important, as I told you, patient education during discharge. Most importantly, you will be emphasizing and focusing much on the anticoagulant therapy, prevention of any sort of infection. So we do not want any sort of infection. In case the patient is wanting to go out, you're going to be instructing to the patient about how much he has to take care of himself, keeping himself warm, and trying to avoid these kind of cold weathers, and as much as possible trying to avoid infections that is going to be affected, because again the age is another factor. And also slowly resume back to his activity schedule, not at once, because he needs to know how much the heart can handle. Okay, so all this has to be done after a few rounds of follow-up sessions, and only then the patient is going to be slowly resuming to his occupational activities. And repeated investigations and blood checks, as I told you, and also sometimes on follow-up and coming back to the hospital for checkups, he's going to also go have an echocardiogram done, so because we need to know how effectively the valves are functioning and how much the effective the treatment. And I think we have come to the end of the session. We shall discuss another valve disease in my next session. Thank you for your time.